Okay. Hi everyone. We're gonna go through the flexibility portion of this unit. It's only gonna be two slides and just a couple of slides per PowerPoint here. All right, so in this section, our learning goals are to understand the benefits of flexibility and mobility, understand issues associated with being inflexible or hypermobile, recognize the properties of soft tissues, identify factors that impact joint range of motion, and identify the usefulness of myofascial release techniques. So flexibility and mobility, there's a difference between the two. So flexibility is going to be the ability of the joint to move through a full range of motion, while mobility is the movement ability during multi-joint actions requiring body segment coordination. So an example of this is your hips mobility while you are squatting. So there's going to be a lot of joints that uh, are part of this. So your ankle joint, knee joint, and hip joint all play a role in you squatting. So it takes mobility for you to actually get into this squat. There's more examples of this, but that's how you're gonna just get the difference between flexibility. It's just gonna be one joint, while mobility requires a lot more coordination between different joints. And then a client can be flexible at a joint, but have poor mobility in a region. So someone can have really good hamstring flexibility, but still have really tight hips and not be able to get into that proper squat form, right? Or have really flexible quads and can reach their heel all the way to their glutes, but still can't get into a good squat. Right. So bilateral discrepancies are also common. So it might be that you have good uh flexibility on one side and poor flexibility on the other. This can be due to many reasons like injury. So there's differences between bilateral joint movement capabilities depending on several variables, including genetic variations, activity participation. So if you are a baseball player, you might have changes in flexibility in your right versus left side of your rotator cuff, some strength balance. So if you have uh, any issues where you are tighter, I'd say on the anterior portion of any structure more than you are the posterior or vice versa. Activation issues in any muscles, connective tissue discrepancies, so any injuries to or any previous injuries in any of your ligaments. Resting postural alignment. So we went over that when we went into some posture stuff, and then joint injuries. So flexibility and health for performance. So benefits of having good flexibility is that you're going to have increased range of motion, and any movements that you have will have a better range. Reduction in the rate of functional decline, postural symmetry, stress reduction, reduced tension, muscle relaxation, reduced incidence of muscle cramping, reduced risk of injury, relief of muscle pain, and improved quality of life in general. So flexibility equals lower stress. So activities that emphasize flexibility reduce musculoskeletal stress via alleviation of tension, reduction of psychomotor distraction, and improved state of overall relaxation. So a good example of this is yoga. When you're doing yoga activities, it causes you to be in these stretches for long periods of time, which relieve stress inside of your muscles and release a lot of tension and trauma that we hold within our body. So hypermobility, it's a more common thing being talked about nowadays. Some people have hypermobile joints, and this can actually put them at risk for injury. So hypermobility is movement capacity beyond normal range of motion. Maybe you've heard of it being called hyperextension of certain joints. So if you ever seen someone like put their hands up high and their elbow kind of goes beyond the normal flatness and kind of goes beyond that joint. It's mostly seen in women, and we'll talk about why when we get to how flexibility is affected in the sexes. Um, but yeah, this is going to compromise stability of joints and obviously, like I said before, increase their risk for injuries since they have a little less stability than normal. So what they're going to try to do is to strengthen the joint and avoid stretching it. So what they're going to want to do, especially like in their shoulder joint, especially before movements like strength movements and also any type of sports activity, they're going to want to activate those stabilizing muscles like the rotator cuffs in the shoulders, and some of those glute muscles, the deeper glute muscles for the hips. So properties of soft tissues. So soft tissues in the human body include your muscle and its fascia. So the like tissue that encapsulates those muscles and keeps them together. Your tendons and ligaments. So tendons are the ends of muscles, the where they attach to bone. So it turns muscle, it goes muscle, turned into tendon, and then that's where it attaches to the bone. And ligaments holds together bone to bone. You have skin fat and collagen. We'll get a little bit more into collagen in a little bit. Synovial membranes, and those are going to be basically those joint capsules. And then you have your nerves and blood vessels. So these properties include elasticity, which is the stretch tissue that can return into its original state. So think about a rubber band. And you have plasticity, so tissue that can become permanently elongated after stretching, and viscosity, so variable fluid resistance to stretch. Uh, so think about a warm up here and how we warm up to get more uh, stretch in our tissues and more elasticity as we see here. So muscle connective tissue uh, impacts range of motion. So collagen, as we said before, so a lot of our muscles are consist of collagen. So this is collagen content is going to determine the extensibility of whatever tissues it is. So we have collagen more than just our muscles. We have it in our skin as well. So think about the more collagen someone has, the better extensibility, or elasticity that there is going to be there. So it doesn't stay in its plastic form where there's not going to be any type of rebound to that. So elastin allows for greater deformation potential. So when there's more elastin in that tissue, that's when it's going to have more potential for it to stay in that form once it's stretched. So high muscle stress, equals myofascial restriction, trigger points, and pain. So we'll get into more of what trigger points are. Remember myofascial, it's muscle and fascia, and basically those two structures together creating basically a knot or a trigger point. So any stress inside of that muscle will create those trigger points or knots, as you usually hear them being called inside of your muscle. So myofascial restriction release. So restriction and trigger points can be alleviated using different treatments, including stretching, manual massage, and there's different ways to do that. A quick way for me to explain that, especially when someone says manual, that means that someone is actually putting their hands on you and manually working on your body. So that can be done. Uh, and there's also like here at the end where it says pressure rolling using foam rollers or related devices. There's also massage guns that can work with doing this as well. So with that, in order to get proper myofascial release using either manual massage or any of these foam rollers or devices, what you want to do is stay over that area for a long period of time, maybe about 60 to 90 seconds if possible. So about a minute, you want to stay over that knot or that myofascial trigger point, and then that's going to help you release that restriction. And then you just repeat this process. Obviously, you want to warm up the body and either warm up on a treadmill or bike, getting the whole body warmed up. You can lightly go over the skin, creating some sort of blush before you actually start to put pressure on that point. That will help the warm up. But yeah, that's how you're going to get a good myofascial release. You can just do the warm up with just heat pads alone. So if you guys and you guys seen a hydroculator, which is that big machine with really, really hot water, and there's clay pads inside there. You put them in between these really thick towels and you use that as hot compress. That can help with any type of myofascial restrictions as well without actually getting anything manual in there. And then you have electrotherapy and acupressure. So acupressure actually goes along with those manual massage and the pressure foam rolling. You just have the only difference with the acupressure is that you're getting at certain points in the body. There's acupressure points in the body that help relieve a bigger portion of the body just by getting those specific points. For electrotherapy, if you've ever heard of e-stim, that's when they put those electric pads on your skin and they turn up to a tolerable level where the electric stim is actually creating a contraction in your body. Through that contraction, you're getting more blood flow in that muscle, and that helps alleviate those restrictions as well. So your nervous system impacts your range of motion as well. So within each muscle, you have your muscle spindles, and it's going to identify stretch length and speed, and there's going to be a reflex there so your body's able to know how far it's actually able to go without hurting itself. And you have that Golgi tendon organ, which is involved in autogenic inhibition to protect from those tears and overstretching. So in those muscle spindles, you have that Golgi tendon organ that's going to remind your body that that's the limit. And it's going to prevent any tears or overstretching, right? The mechanoreceptors are going to signal and detect stretch, velocity, pain, joint pressure, posture, sensation, and reflex inhibition. So these are another way that your body is going to protect itself from injury. And then we have reciprocal inhibition, which we've talked about before, but another reminder, you have your agonist and antagonist muscle, and they have some sort of contractile relationship. So they work together to keep an alignment in whatever structure it is in your body. For example, there's your quads and your hamstring, and those two work together as agonists and antagonists in a reciprocal inhibition form to keep your body stabilized. This is going to be especially noted at the shoulder joint, where you have a lot of muscles around that shoulder joint to keep it stabilized. So think about how your rotator cuffs, you have internal and external rotators, and they work with reciprocal inhibition to make sure that your shoulder stays stabilized. So age can impact your range of motion. Your sarcomeres, which are replaced with collagen, will go and cause fibrosis. So this can happen once you age. So loss is dictated by genetics, physical activity, health status, and fitness levels. So obviously, the more you increase your fitness levels, the more you are going to be set up for um greater dependency as you grow older in age. Physical activity across your lifespan has great impact on decline. So that's just a better way to put it in general. Not only does resistance training and cardiovascular training impact how you will be dependent and how slowly your body will decline, but also a big one is your flexibility, which will help your range of motion. So now that we talk about, usually we note differences between males and females. In resistance training, we also saw how it impacts them in cardiovascular training. Well, it's going to impact how flexible they are as well. So females possess anatomical variances, but the range of motion is usually the same between males and females. There is a difference in how females have a broader pelvis at the top and it goes narrow at the bottom. So this is just going to impact certain ranges of motions with some movements. Their olecranon process, that is going to be their elbow. So that's going to allow them to go into that elbow hyperextension a little bit easier. So that's why I said you're going to see that a lot in females. And then greater trunk range of motion in females. And they're going to also have shorter legs and a lower center of gravity. So that's going to change between males and females. That center of gravity changes from the men having it in around their belly button to the women having it lower at their hips. So body mass and we just said range of motion can impact range of motion. Sorry, body mass and resisted movement can impact range of motion. So, a very easy example to think about with this is bodybuilders. Obviously, the more mass they have, the harder it is for them to reach certain places. In any of their lifts, if you go on YouTube and look up a bodybuilder, you're gonna see that their ranges of motion aren't as large as someone who has less muscle size. Also, you're going to notice this in obese clients, especially in their trunk. If you're going to have them do any type of sit-up motion, it's going to be very difficult for them to get through that range of motion because of the amount of mass that they have. So weightlifting can improve mobility when using full range of motion. So this is going to be said a lot, especially with any type of exercise. You want to move through its full range of motion to actually get the full stretch and the full stretch and contraction in that exercise. Unilateral and open circuit training is useful. So if you want to make sure that you're getting um, something without having any type of imbalance, it's better to just do one side at a time. And that way your training is going to be a lot less imbalanced. All right, immobility and pain impact range of motion. So immobility greatly impacts range of motion and elasticity and extensibility. Discomfort thresholds vary among clients for overstretching. Sorry, discomfort thresholds vary among clients for stretching. Discomfort following injury, like an ankle roll, can be alleviated with enhanced warm-ups. This also goes for any type of injury that includes any type of tendons or ligaments. A better warm-up, the better it is to get through that activity. So injuries impact range of motion. You have bursitis. So in certain places in your body, you have these structures called bursa, which prevent your body from getting impact in certain places. So you have bursa around like your elbow when they protect your elbow from getting a lot of impact. You have them around your knee. And there's other places in the body where you have bursa. But anytime you say the word itis at the end of the word is because there's inflammation of whatever structure it is that they're naming. So bursitis, tendonitis, fasciitis is inflammation of whatever it's being said. And then you have those impingement syndromes, which we talked about before. Really common is your anterior shoulder having impingement syndrome because of inflammation, again, to all the structures that cross over in front of your shoulder. And then you have diseases that can impact range of motion. Osteoarthritis is um, just inflammation of your bones and joints, rheumatoid arthritis as well. And then you have gout, which is a buildup of uric acid in any site at your body. This can happen in any spot for the most part. And then some considerations here in summary. Knowledge of stretching techniques can be really useful. Having and making time and available for you to stretch is very important. A lot of people forget and just pass over stretching because it's just not it seems that you're not getting anything out of it, but you are getting a lot better recovery to move on to the next exercise bout if you do make time, even if it's just a little bit for stretching. You need to identify any deficiencies that you have. So make sure that you're testing your body when you can to see, especially if you have any type of imbalances between the right and the left side. You want to be as balanced as possible. Then you need to identify any of the deficiencies so you can treat them or treat them in your client as well as you can too. And then clients' pain tolerance and interest. Um, like I said before, imbalances or if they've had any injuries in the past that you need to be aware of, orthopedic limitations, if they've had surgery in a certain area, maybe can't get into any position that you may want to have them try. Just, keep talking to them and making sure that you take a good history. Um, or if they have any of these diseases that we just mentioned, this is important as well. So these are factors that you need to just consider when it comes to flexibility. All right, moving on. We're going to go into the next slide, which is types of flexibility and programming. So types of flexibility training and programming strategies. Here we are going to understand common techniques for assessing flexibility, understand different types of stretches, recognize general guidelines for flexibility training, and recognize and be able to implement common flexibility techniques. So, in order to assess someone's flexibility, you use either a goniometer, inclinometer, or a flexometer. A very common one is the goniometer, then you'll see there in the picture, and there you're just going to assess the angle of that joint. So indirect, you have stretching mats, uh, the sit and reach box. So a sit and reach box is a good way to assess hamstring flexibility. You just have the person sit down with their legs out straight, and the box is going to be pushed as far as they can with their hands as they sit, and the knees don't come up off of the floor. So movement screenings are useful. This is how you're going to assess how someone is when you take a baseline at the beginning of their program and then have it taken after a certain period of time. Just how you check weight and you check body fat, you also want to check flexibility. As someone gets stronger, you will see that um, they have more movement in their muscles. They're probably going to increase their flexibility, even if they don't spend a lot of their time in the workouts doing flexibility training. As long as they have some period of recovery, of a cool down where they are stretching after their workouts, you will see impacts in flexibility and mobility as well. So types of flexibility training, you have techniques used to enhance range of motion, and they're classified by either active stretching or passive stretching. In active stretching, uh, it's going to use the force produced by the client to apply the stretch. So you're not helping the client when they're doing active stretching, they're going to do it themselves. And then when they're doing passive stretching, this involves an external force. So you as a trainer can be applying this external force to the client or a partner that they have that they're working out with. Gravity can be something as well. But it's not as strong as somebody actually pushing them. Stretching devices like a strap that they can use to pull the body segment closer to them. Um, Even using the floor is technically uh passive stretching. Like if you're in a V sit and you're reaching for your toes, the floor is still helping you there. So again, it's a little confusing here, but an active stretch is the person using just their muscles, um, and the force of their muscles to apply the stretch. What I really think that you can think about this as is flexibility and mobility. Mobility is very much like active stretching, and flexibility, you're going to be using passive stretching. So active stretches also is something that you want to use for um your warm-ups. You want to do a lot of active stretching in your warm-ups and passive stretching at the end of your workout as a cool down. And then you have these two here, which break it down a little bit further between warm up and cool down. Static stretches, um, static flexibility can include active stretching, active assisted stretching, proprioceptive neuromuscular facilitation, which we will go into that. But if we don't, it's just a stretch where you put the client in their stretch and then they push against you, giving it some sort of activating force. And then after a few seconds, they let go, and then you're able to push them just a little bit further in that range of motion, and you have active isolation stretching, right? So static stretching can be used at the end of the workout. I know I said active stretching can be used at the beginning of the workout, but I think they have a different definition here. Dynamic stretching is what I want at the beginning of the workout. So dynamic performance stretching, slow speed dynamic stretching, and ballistic stretching. We're going to go over each one of those as well. So again, the static stretching. Um, it's going to be better if you use it in your cool down. So you're going to perform this in a slow, controlled manner to your terminal range of motion. So right when you get your stretch reflex, that Golgi tendon organ is going to let you know when you've reached the end there. That's where you're going to be holding your stretch. And again, ideally, you want to use this during your cool down, and it can reduce power and force output if you're going to do it before your maximal training. So you don't want to do this before training. You want to save static stretching for after. Active assisted stretching. Um, this is going to be just adding an external force. So as you see there, they have the strap, and they also have the trainer or a therapist, maybe he is as well, uh, getting them to that range of motion. So the trainer or assistive implement, like a band, can be used there. You're going to use caution to avoid overstretching, and it's going to require a trainer or client communication if you are helping someone stretch. This is that PNF stretch I was talking about. You're going to go into the range of motion. So here he's helping him do the hamstring range of motion. And you're going to go into a 10-second passive stretch. After that, for 6 seconds, you're going to instruct the client to push and resist against you. For those 6 seconds. After those 6 seconds, the client is going to relax. The trainer is going to keep holding that position for up to 30 seconds or until they feel discomfort. After they've pushed against you for those 6 seconds, you're going to feel that they have a little bit more range of motion to give after they've let go. So dynamic stretches, uh, it's going to help you out with getting range of motion gains related to specific movements employed during training. So it's really popular in sports, and you're going to use this to prepare for whatever sports activity you have. You're going to use this for both a warm up and improve range of motion. Provide a warm up and then including your range of motion improvements as well. So this is why you want to use dynamic stretches before activities, specifically for sports activities. Dynamic performance stretches, you're going to use a variety of sport or exercise specific movements that functionally stretch musculature to be utilized. Movements are often exaggerated to attain the greatest range of motion. So this is an example of this is like high knees, and hurdle step overs. And then you have your slow speed dynamic stretches. So slower, more isolated movements are utilized here. You're gonna uh, give yourself a designated time for each rep, and you're going to ensure there's going to be controlled contractions and no activation of that stretch reflex. So an example of this is getting into deep squats or single leg squats. So those are different types of dynamic stretching. Here's an example here. It's those leg scoops. It's pretty hard to understand what's going on here, but basically they're getting a good stretch dynamically in their hamstrings and calves and their glutes as well. Ballistic stretching can be part of dynamics. It is going to allow maximal range of motion because you're using momentum. You're going to see this a lot when runners warm up. So sometimes for many people, it's contraindicated because it will put them at risk for injury, especially if you already have an issue. You don't want to exacerbate that issue by, using momentum to get into that range of motion. But yes, commonly used in athletics for warm up. And then when you're programming flexibility, you decide whether you're using static or dynamic. But like I said, dynamic before the workout and static after the workout. For the volume, you want to use about 10 to 12 reps for about 2 to 4 sets. And then for the static holds, you want around 15 to 30-second holds. And then 5 to 10 seconds contractions for the PNFs. If you are doing PNF stretching, you can do PNF on your own, but let's say you're doing this with a client, you want them to resist against you for only about 5 to 10 seconds and then continue on with another 6 to 12-second hold, right? Sorry. Dynamics. Um, so you want to accumulate about 1 to 2 minutes of stretch per muscle group. So make sure that you're getting not just one muscle group, but you're getting all of them with different stretches, especially the ones that you targeted during that workout if you're finishing off with your static stretches. And then with intensity for this, you want to get to your point of no pain, but you are getting a good stretch there. So right before you feel that resistance in your own body protecting you from any injury. The duration for your total stretch time can range for 15 to 30 minutes, but you probably want to get that to the lower end if it's just at the end of your workout. If you do it every day, this will be okay for you to just give it about 10 minutes. Frequency, a minimum of 2 to 3 days a week, but again, most days if possible. And putting the pieces together here, explain the techniques and protocols to the client to establish an open communication, perform an appropriate warm-up, select at least one activity per major muscle group or joint action, order order deficient areas first and perform others in order of need. You're going to perform about 2 to 4 sets with 30-second holds to accumulate the duration with multiple sets. You're going to start slow and progress to greater ranges. You're going to use multiple planes of movement with each muscle group. You're going to require a strict protocol for adherence. So make sure that you have this in your workout plan, because if you don't, you can't assume that they're going to be doing this on their own if you don't write it down, right? So use dynamic flexibility before static flexibility. So you do want to make sure that the muscle is warm if you are going to be using static flexibility. Establish static stretch proficiency before including PNF. So PNF is when someone's already used to stretching. You don't want to put someone in a vulnerable position at their full range of motion and then have them give you resistance. So it's gonna be pretty tough for them to give you force if they're not even used to being in that position, right? So stretch to tolerable discomfort but not pain, and use controlled breathing in a rhythmic pattern as you go through your stretches. And then record any pains experienced during movements and look for compensatory actions. So, oh, that's an important one as well. You don't want to compensate with another body part while you're stretching. If you are compensating, you're not getting the stretch that is intended for you, right? And here are some sample stretches. You can always refer back to these, especially for your programs, if you need some assistance looking for different stretches. If you can't come up with them, I'm sure you can Google them to get some more stretches. But again, try to get something for each body part that you targeted during the workout for each exercise. Here are also some dynamic stretches that you can use before, but not all of these are dynamic, right? If you're rotating or moving or leaning over, uh, and you're actually like moving, this is a dynamic stretch. But if you're holding that muscle in place, know that that is a static stretch and it belongs at the end of your workout. All right. Uh, I will see you guys next time. And the end of this here.